Hi there, my name is Megan Schubert. I am a student of the Surgical Technology program at Marine Park. Today what I want to talk to you all about is the surgical technologist duties for maintaining aseptic technique on the sterile field. What that means, aseptic technique is the prevention of disease transmission. As a student, we are taught very methodical approaches to maintaining sterility in the case. A lot of times we think about the surgical tech, you might think I'm the one to pass off the instruments or do the suction during the surgery. What we don't think about is what happens before the surgery, how the room gets set up, and how we, as a surgical tech, what we need to do to be sterile. There's going to be four main components four main things that happen prior to surgery. Number one is the surgical attire, what we wear. Number two is going to be our hand washing and our surgical hand scrub. Number three is gowning and gloving. And number four is opening up the case. I'll talk a little bit more about those in detail. Surgical attire. What is surgical attire and who wears it? Both the non-sterile and the sterile team members of the surgery, of the operating room, are going to wear surgical attire. Surgical attire is going to be our shirt and our pants. Lint-free material, very loose fitting. We have a mask. This is going to be changed before and after every case. We wear a disposable head cap. This goes on, we want to make sure all the hair is tucked in. They do make woven cloth head caps. You may have seen a surgeon wear those before, the cloth ones. Those can be laundered. They are acceptable by some hospitals, but they're not recommended. Really what's recommended is a disposable head cap and then eyewear to prevent any splashback of blood, bodily fluids. So this surgical attire is to protect not only the patient, but it's also to protect the surgical team members. And again, it's worn by the sterile and the non-sterile team members. Who's non-sterile? That's going to be our nurse, our circulator, and the anesthesia care provider. They would walk into the operating room just like this, of course, with the mask on. A sterile team member is going to be myself, the surgical tech, and the surgeon. So once we have donned our sterile attire, we then move on to our hand washing. Hand washing is the most important aspect of disease transmission. Unclean hands transmit so much bacteria, they transmit so many different diseases, and are one of the main causes of hospital-acquired infections. So hand washing is very important. Our basic hand washing that we all know, you might sing the happy birthday song, you might sing the ABCs, 15 to 20 seconds, soap and water. You want to vigorously, and I say vigorously, rub those hands together. This mechanical action of rubbing the hands together is what is going to remove most of the bacteria. The soap and water itself is going to get a little bit off of there, but that mechanical hand rubbing is going to remove most of the bacteria. This is done all the way up the arms, up to about 2 inches above the elbow. So both non-sterile and sterile team members are going to perform that procedure. Once that is done, then the sterile team member would then move on to the surgical hand scrub. The surgical hand scrub is done by the surg tech and the surgeon, and we're going to start by removing any dirt and grime underneath our nails. We are given a little pick to do so with. So we just go in there, we get all of that dirt and grime out from underneath the nails. The next step is a sponge. Now this sponge is going to have bristles on one side, sponge on the other. This is already preloaded with whatever antiseptic agent that the hospital chooses to use. Most commonly is going to be iodine. So that sponge is already loaded with the iodine. You get it wet, you lather it up, and again, very methodical approach here. We have a counted brushstroke method. So what that means is we've got our 4 fingers and our thumb. We're going to start with those. It's going to be divided into 4 planes. You've got the front side, the back side, and then either side of your thumb and fingers. So you've got the 4 planes. Each plane will get 10 brush strokes. The webs of our fingers, webs in between our fingers, 10 brush strokes. Palm of our hand, both sides, and then either side here, divided into 4 planes again, each getting 10 brush strokes. Our forearm, divided into 3 sections, 4 subsequent planes on each section. Each one of those will get 10 brush strokes, and then we move up about 2 inches above our elbow, Each plane here, 4 planes again, will get 10 brush strokes. So it seems tedious, but this is something that we need to do to maintain sterility. So once we get the one arm done, we then move to the other arm. Once you've got both hands washed, lathered up, you're going to hit, there's usually a foot pedal to hit for the water. You want to hit that and rinse off our hands. When we do this, we make sure that we do not touch the sink. We do not touch the faucet. Your hands, your arms don't touch anything. You simply, the running water, you simply take your one hand and go up and let the water drip down and take the other hand. We always make sure our hands are above our elbows. You never let your arms drop here. Even in surgery, we've got a plane right about here from our chest to our midsection. This is our sterile area. This is where our hands always stay. So hands are going to be above your elbows. After you've rinsed them off, you let them drip dry. Prior to doing this, you have placed a sterile towel behind you. So once you've got it mostly drip dried, you turn around, you grab that sterile towel, you just pinch it, and you slightly bend over and simply pat up and down your arms, just like so. The reason I'm bent over, I don't want water getting all over my surgical attire, my scrubs. If I get water all over, it's called strike-through contamination. We would have to start over, change, start over, do the whole thing again. So I'm bent over, patting dry. Throw the towel off to the side, circulator will come by and grab it. You walk into the surgery room, into the operating room, into the surgical suite, it's also called that. Once you get in there, again, prior to the hand wash, you have placed a sterile gown and gloves on your Mayo stand. So you walk in, you pinch your gown, and you're slightly bent over again here because your hands may still be a little bit wet, and you go ahead and put this gown on. Now notice my hands do not come through here. The circulator or the nurse is going to walk by and tie you up here. Again, they are in the non-sterile role, so they can do that. They don't need to wear gloves or anything. So my hands are not through here. There's a specific way that we put on our gloves, like so, and we kind of pull our hands through that way. So while I'm doing this, the nurse has got me all tied up here. Now when the surgeon and the first assistant, anybody in a sterile role, I'm the first one in the operating room. So when the surgeon is ready to come in, I am going to assist him or her in putting on their gown and gloves. So we've got this set here. If something were to happen, if I were to get a rip in my gloves, my hand were to come through, I would need to make sure to change that, to fix that error, to go back, start over, and redo it. So once we are gowned and gloved, I am completely sterile. I would have my mask on. I am completely sterile from head to toe. Again, I'm going to keep my hands right here. I'm going to go ahead. My final step is opening up the case. All that means to open up the case is get out that instrument tray, set out the instruments on my back table, set out the instruments on my Mayo stand, and perform a count of the instruments, of the sponges, of the blades, syringes, of any disposable supplies. Perform that count with my nurse or my circulator. This count is very important. We need to make sure we keep track of all the items during surgery, and we have a counted item for after surgery. So once that is done, I'm set to go. I am ready for surgery. So in the end, out of all these 4 steps, contamination can happen at any one of those steps. Again, this is why we are taught aseptic technique. We are also taught to have a surgical conscience. A surgical conscience means if we make a mistake, we're human. Own up to it. If you were the patient on the table, wouldn't you want us to own up to it? If I were that patient, I would want my surgical tech to own up to it. It's as simple as that. So we're taught the aseptic technique. We're taught those methodical approaches to all of the procedures that happen before the case, and we have to maintain that surgical conscience. In the end, it could save your life as a patient. Thank you.